Welcome to Module 3 on personal care. We will be discussing bathing and massage. Objectives: discuss factors that affect a resident's personal hygiene practices, identify observations to report and document, discuss special considerations for back rubs. Think about what you needed to do for yourself with personal care since this morning. These personal cares, such as going to the bathroom, brushing your teeth, your hygiene, dressing and grooming, bathing or showering, shaving, feeding yourself breakfast, are also part of resident care. We as nurse aides help meet residents' personal needs on a daily basis. However, nurse aides should encourage residents to perform as many tasks independently as they can to help promote a sense of dignity for the resident. Check the care plan if there is any question on how much assistance a resident should be offered. Personal care. This slide gives us a few factors that may affect hygiene practices in people. Hygiene is defined as the term used to describe methods of keeping the body clean. Family may define how often it is acceptable to clean the body. Did the family view a weekly bath with daily sponge baths as acceptable? Was it expected that family should bathe daily when the resident was a child? Culture may dictate hygiene also. If living in the desert, the culture may be to conserve water and not waste it. Learned behaviors may also go back to how the family dictated hygiene. Disability may prevent an individual from cleaning their body. If a person has left-sided weakness, will the right side of the body get thoroughly cleansed? Age may also dictate their hygiene. The older body still needs to be cleaned, but because the person is less active, the body may not become as dirty as it used to. However, if the person is incontinent of urine or feces, hygiene may be even more important than before. Here are a few examples of how you can provide respect and dignity when performing personal care tasks. Promote as much independence for the resident as possible, according to the care plan. You can always offer more assistance, but never less. Empathy is not sympathy. Remember, empathetic is identifying with them and understanding their feelings. Always explain what you are doing and answer any questions that the resident may have. Try not to rush them. Give the resident time to do what they can for themselves. Offer them choices. Examples could be choice in clothing or different food options. Finally, always remember, be patient. Time is not going to end in a minute. Here are 4 basic types of baths. We talk about a partial bed bath, also known as a setup bath. This bath involves washing certain areas: the face, hands, armpits, the folds of the skin where there's skin on skin, like under the breasts for women and in the abdominal folds, the perineal area, and the buttock. Residents may choose this bath because they have drier, fragile, more sensitive skin, and their scheduled bath or shower has already taken place, and they just want to freshen up. The next type of bath is the complete bed bath, and we wash the entire body while the resident is laying in bed. This bath is offered when the resident is unable to get out of bed. Whirlpool baths are tub baths where there's jets to help circulate the water. Showers are offered, but a resident will need to be sitting down in a shower chair to prevent them from falling and having an injury while showering. The decision about what type of bath to give a resident is determined by the doctor or the nurses together with the resident. A doctor may not want the resident to bathe in a tub because the resident had recent surgery, even though the resident wants to take a bath. If this situation occurs, ask the nurse. Safety guidelines in bathing. Safety is our biggest concern with bathing. Keeping residents covered as much as possible will give them privacy, dignity, and also to keep them warm. If a person is warm, they are less likely to be rushing to get out of their bath or shower, and that helps them prevent falls. Infection prevention is a must. Always sanitize surfaces of equipment that we have for showering and whirlpools before and after each use. Always ensure floors are dry prior to having any staff or resident walk across it. Tile floors are typically very slippery when they're wet. We should never leave a resident alone while they are in the tub or shower, unless it has been specifically care planned that way. Be certain that you have all the supplies and equipment you need before starting the bath or shower, as you cannot leave the room. To prevent burns, always ensure that water is 105 degrees or less. Most residents will want the water cooler, perhaps closer to 100 degrees or even less. Check with the resident on the water temperature. Here is a bathing wheel. This will help you remember what parts of the body need to be cleaned and the order to clean them. We want to wash from cleanest to dirtiest. Start with the eyes, cleaning from the inner portion to the outer. Proceed to the rest of the face, periodically changing the surface of the washcloth as needed. No soap should be on the washcloth when washing the face. Continue with the ears using soap. Follow with a rinse and pat dry. Wash the arms and axilla next. The axilla is the armpit. Soak hands in a basin and proceed with nail care. After rinsing and drying, lotion can be put on the skin, permitted by the nurse. Next, wash the chest and abdomen. Take extra time to wash, rinse, and dry under all the skin folds, such as under the breasts and the abdominal folds. These are areas that are very susceptible to bacteria and fungal infections. Report any redness to the nurse. The legs and feet are next. If possible, allow the feet to be soaked in a water basin. At any point that the water becomes too cold or too dirty, the water should be disposed of in the toilet. If you're giving a bed bath, we always empty the water in the toilet. Do not pour it down the sink. After washing the person's back, then the private areas, the perineal area, can be washed. That's when we need to have the water changed. After you wash the back, change the water, provide the perineal care, wash, rinse, and dry, then turn the resident and wash their buttocks. Always remember to wash from the front of the body to the back. We always work from front to back. Pull bacteria away from the urinary tract. Bathing should be an enjoyable experience. Keeping the room nice and warm will help the residents relax. Also have them test the water prior to bathing if at all possible. Besides promoting increased circulation in extremities, it gives staff an opportunity to observe the skin and the entire part of the body. Report any redness, sores, discolorations, painful areas that you see. Complete bed baths are not frequently done, as residents are usually encouraged to be out of their bed. Weakness and recent surgery may be reasons to have to give a complete bed bath, but remember that a doctor or nurse will help you make that call. Paralyzed residents may have a complete bed bath ordered if it is determined that they are not safe in a bath chair or shower chair. Just because a resident is paralyzed does not automatically make them a candidate for a bed bath. No unconscious resident should ever be bathed in a whirlpool tub or shower. Residents who have a cast because of a broken bone, or if they are in traction and there was no surgery performed for the broken bone, will need a bed bath. Partial baths are given on a daily basis, usually twice every day for every resident, if there is not a scheduled whirlpool or shower on that day. Most facilities will call these baths AM care, morning care, bedtime care, or HS care. HS means hour of sleep. They may be thought of as set-up baths, but can be done in bed, or some residents prefer to have these done at their sink. Another option in bathing is using a thermal bag. Thermal bags are plastic bags with disposable or reusable washcloths that are moistened and warmed in them with a cleaning agent. No rinsing is required, and the skin is left to air dry. The bag can be placed in a microwave to warm the cloths, or some facilities have a warming bin that stores the thermal bags, keeping them at a warm temperature. If they are manufacturer-made, follow the directions on the package. Some considerations for bathing and dementia. Dementia is having a type of memory loss or loss of mental abilities and causes much confusion. Try to allow the resident to determine when the best time would be, when they're most likely to be cooperative. Talk to staff about how this should be done. Some days are better than others, and you might need to make several attempts before a resident is willing. Sometimes bathing in clothes is appropriate. People who have dementia may be frightened if you ask them or start to assist them with undressing. Most importantly, if the room is not warm, do not expect the resident to undress or bathe and like that experience. The care plan will determine how often a person has to have their hair shampooed. Typically, most residents have a hair shampoo once a week. However, some may use dry shampoos or water shampoo from their beautician or stylist. Most facilities offer a beauty shop for perms and curling and fixing hair. Lastly, back massage. Back massage is a great way to help someone relax. Nursing assistants can offer a back massage at least every day, preferably at night before bed. Gloves are not needed for a back massage unless the resident or the staff person has a broken skin area, such as a cut. Never massage an area that is paler than normal, white or red. Report those areas to the nurse right away. This is the end of our first part of Module 3.